According to the Kaiser Family Foundation, a survey of adults this year found an estimated 24% of Montanans had reported symptoms of anxiety or depression, and nearly a quarter of those had an unmet need for counseling or therapy. In our To America series, we are aiming to cover the America you know and the America you may not. One Montana man shares his story of living with a mental health disorders and the challenges he has seeking help. Over coffee with me, Zachariah Crawford shares what's going on in his mind most days.
Hearing like voices like telling you something or somebody talking to somebody, and then you'll think that they'll be telling you something, but in actuality they didn't even tell you anything.
Crawford has been diagnosed with several mental health conditions.
Bipolar, and then like schizoactive personality disorder, dyssocia or something like that.
It also comes with mood swings.
Like laughing, and I'll be like, and I'll feel so happy, and I'll be like, oh, I'm so blessed. And then like a second later, I'll start crying for some reason. I don't even know why I'm crying.
Crawford is homeless, and he says finding professional care for his disorders can be difficult.
A lot of the mental health is overlooked because there ain't really enough like psychiatrists and mental health people really around as much as there should be.
In general, there's a shortage of providers. There's a shortage of psychiatrists.
A 2018 report, Health Resources and Service Administration estimated around 100 licensed psychiatrists in Montana and suggested the state would need an additional 70 to meet demand. However, by 2030, the number of psychiatrists in Montana is expected to fall to around 70, leaving the state with an estimated shortage of around 90 psychiatrists. But there are efforts to address the shortage and increase availability of care. Those include recent awards from the Substance Abuse and Mental Health Administrations of nearly $18.3 million to 6 Montana mental health community centers, and a 4-year $1.9 million grant from the U.S. Health Resources and Services Administration. They will allow Montana State University and the University of Montana to continue a program that trains students to better serve individuals with mental health care needs. These programs will bolster the work of places like Our Place, who helps Crawford with things like obtaining vital records, and case managers who can connect them to care, tasks that Crawford says can be difficult.
We don't know to put yes or no, or to be like, because in our mind it'll be like, to other person it'll be plumb plain, it'll be like, oh yeah, that's yes. And then to us we'll be like, well, if I put yes, and then will that make it no, or is this the right one? And then sometimes you don't have, and so you can't really decide on your own because you haven't really done it that much yourself.
And for people who may be in crisis, who need immediate care, Prigmore says they work really hard to get people the care they need immediately.
We are seeing need rise, and we do see more clients coming in situations of crisis and in situations of need. And we work really hard to get people in more quickly. The one piece of advice I would say is if you are in crisis, make sure you say that you are in a crisis and that you need help sooner rather than later. I think that's extremely important.